Hello everyone, we are going to start our lab today, and in the lab we are going to do today sternum, ribs, vertebral column. We did the ear ossicles. Okay, I'm changing the color. So vertebral column, we did the ear ossicles last class, so we are not doing it today. Okay, but you are going to cover it still, so, but not today. Okay, so today it will be sternum, ribs, vertebral column, and that's all. So we'll finish it. And next class, we are going to do these muscles. Okay, so muscles are not that difficult, and there are only 8 of those that you will have to learn. So it's not that bad. Okay, so coming back to sternum, we are going to look at manubrium, gladiolus. You can also call it body of sternum. You can also call it body, okay? And the xiphoid process. So we are doing 3 things in it. Now, PowerPoint and the handout that is available to you on your Blackboard. So let's go to the sternum. This is a good photograph of sternum. Sternum is present in the center of the thoracic cavity. In fact, it makes the thoracic cavity. It's not present in the center of the thoracic cavity, but it basically makes the anterior wall of your thoracic cavity. So the sternum, when you look at it, the top part, which is this part right here, that is called manubrium. Do you understand? That is manubrium. The middle part is your gladiolus. So this is basically your gladiolus. Gladiolus can also be called body. So you can call it gladiolus or body. See right here, gladiolus and body, right over here, right? So you have gladiolus and body, and then the lower part of it is called this right here. That is called your xiphoid process, the lower part, okay? So this makes up your what? Very good. This is going to make your sternum right here, right? Okay. Now that we are done with the sternum, we can do the next. And the next one is we are going to pull up our handout. And now that we are done with the sternum, we are going to look at the ribs. Now, first of all, we are going to do the inferior border, the superior border, inferior border, sternal end, and the vertebral end. Now, before I move to the ribs, the sternum that you have on the campus in the lab, they have costal cartilages attached to it, which means the sternum that you have in the lab is not just the bone that I colored, but it includes the costal cartilage as well. Do you understand? Ah, great. So I am coloring even the costal cartilage. Do you understand? What does that mean? That means these costal cartilages are also attached to the sternum that you have in the axial skeleton boxes. And we know these costal cartilages are hyaline cartilage, right? These are hyaline cartilage. And we did that in the tissue lab, histology. Remember when we did the hyaline cartilage in the trachea, it's the same cartilage. Okay. Now we are going to move on to the next one, which is rib. And we are going to look at superior border, inferior border, sternal end, vertebral end, articular facets, and the costal cartilage, along with you being able to identify right and left rib. So you should be able to identify which one is right and which one is left rib. So let's now look at the rib. And we are going to go to the rib photograph, and great, we don't have any in the handout. Oh, okay, never mind. Google is our best friend, and that is where we always go. So here we are going to Google ribs. Okay, this turned into barbecue ribs. We don't want that. We are going to say ribs skeleton system. Okay, now it looks presentable, and we are going to go to the images. There we go. Okay, so on the rib, let's scroll down. We may, oh, right there. Okay, so the rib, when you look at it, and I like this one, maybe not. Okay. Okay, so we are going to keep scrolling down till I find a nice little okay, so let's just stick with this one. And I think this is a good one. Pinterest is, Okay, so looking at this, and I'm going to expand it a little bit. So what was our superior and inferior border, sternal and vertebral end? Okay, this, follow my little hand. You see this? This is the sternal end because it is attached to the sternum through the costal cartilage. Do you understand? And now I am going to try to find a little rib. So when you look at the rib, the flat end that does not have any protuberances on it, it is smoother. Look at it. It is smoother, does not have any protuberances on it. That is your sternal end. Do you understand that? And then at the back, you see it has a lot of protuberances right here. This is the vertebral end. Lot of protuberances because this is where it attaches to the vertebra. Okay, so there is vertebral end because it attaches with the vertebra and it has all these facets, articular facets and protuberances. And then you have the flat end in the front, that is your sternal end, which articulates with the sternum through the costal cartilage. Now, another thing is, do you see this line at the bottom? It's pretty sharp. That is your inferior border. Do you understand this? So you see this margin right here at the bottom? This is very sharp margin. This is the inferior border. Look at the superior border. This is the superior border. Do you see how it looks rounded? This is the superior border. Now, how to figure that out? When you wrap your fingers around the rib and slide it, you can feel the sharp edge. That sharp edge that you feel, that is your inferior border, and the rounded edge is the superior border. And you can only you can see it as well, but then you can feel it and it gives you a better idea. Now, we did superior, inferior, sternal end, vertebral end, costal cartilage, and articular facet. Now, how do you know left from right? For left, in order to know left from right, you have to align the rib next to your body, making sure that the sternal end is in front, vertebral end is at the back, inferior margin, which is the sharp margin, is inferior or down or touching the table, your table. The rounded margin should be superior. So once you know front, back, top, and bottom of the rib, you should be able to figure out what side rib it is. Now, the rib that I'm showing you right here, this one is sternal end is in front, vertebral end is at the back, inferior margin is the sharp one, superior is the rounded one. It is aligned properly. But keep in mind, this is patient's side. So you have to align it with your own side, because if you look at it, you are going to say, oh, this is the right rib. No, it is not. It is your right, but this is patient's left. Do you understand? So what you are looking at in the photograph right now is patient's left. I talked about sketch fab. Now sketch fab free, these are free 3D models. And then you are going to look for the skeleton. And you can click on all. Well, you may have to tell it what you want. Skeleton. Okay. Rib. So I am going to scroll down on this one. And I am going to make it bigger. And oh well. Now, oopsie. Okay. So you can look at this. You see the sternal end, huh? And then you can turn it around. See this right here? This is the vertebral end, which is articulating with the vertebrae. Another thing, oh, it doesn't magnify. So, oh well. I am trying to show you the edge, but you know, you get the idea. Here you can see right here is the manubrium, this is the body, and this is your xiphoid process, right? And you can do it with all the different bones. So this is a 3D program, but then you also have 3D programs for anatomy available on your cell phones. Android and iPhones both have it. You also have it available on iPads and Surface Pros. They all have those, and they are free of cost. Please go for the free of cost. They are way better than anything else, okay? Okay, so coming back to our handout. So we are done with the ribs. The next thing is vertebrae. So we are going to look at all of the vertebrae. So what we are going to do is do the general characteristics, which is common to all the vertebrae. On there, the general characteristics would be transverse foramen. Oh, sorry, I am on the wrong one. General characteristics is right here of all the vertebrae. What are those? Centrum, or the body. If you don't know how to spell centrum, please write body. Then we are going to look at pedicle, then lamina, then vertebral foramen, spinous process, transverse process, superior articular process and facet, and inferior articular process and facet, and intervertebral foramen, which is made by 2 vertebrae. Okay, so let's now look at the vertebrae. Now, before we start vertebrae, I'm going to show you the entire vertebral column. How many vertebrae are in it? We are going to talk about it in just a minute. You see this? This is cervical. How many in it? 7. You see the pink one? What is that? That is going to be your thoracic vertebrae. How many in that? 12. And then you are going to look at lumbar, and those are going to be 5. And that is your thoracic. Oh, that is your lumbar right here. And those would be 5. And then we are going to have sacral. And sacral is going to have 5 as well, but they are fused. And at the bottom, what you are looking at, this right here, that is your coccyx. And that is going to have 1. So now, how many in all? Okay, so 7 plus 12, how many? 7 plus 12 is? Okay. Then what else? 19 plus 10, 29, right? And 29 plus 1, 30. So you have 30 in all. Now, how do you remember this? Breakfast at 7, lunch at 12, dinner at 5. And then sacral and coccyx, you can just remember 5 and 1. Okay? So in all, you have 30 vertebrae. General characteristics means that it is common to cervical, thoracic, lumbar, sacral, coccyx. Now, what are those characteristics? Now we are going to look at that. And that is when we go to Google again. Okay. We are going to study the parts on this vertebra. And we are also going to refer to this one as well. Now, you see this in the center. This is the spinous process. This is what you feel on the back. You see these things sticking out? Whoopsie. You see these things sticking. Ugh. Okay. You see these things sticking out? These are the spinous processes that you feel in the back. Okay? Then you have transverse processes. Transverse processes goes transversely sideways. Do you understand? So, spinous process, transverse process. Spinous process, think of it like a nose. And transverse processes, think of it like ears going sideways. Then you see this big chunky part, this chunky part right here. This is your body. Understood? Huh? This is the body of the vertebra. Okay, body is this, what I'm holding. So, spinous process, transverse process, body. This right here in the center, that is your spinal cord, which is sitting in the vertebral foramen. Okay, so what is this? This is your vertebral foramen. And what is sitting inside it? Your spinal cord sits inside it. Now, what makes up the spinous process? Spinous process is basically made by, you see this part? Oh, never mind. Does not show the color. So I am going to take dark color. Okay. You see this part? This part on either side, which is this part and this part. On either side, that is going to join this side and this side, and this side is going to join together and make the spinous process. So this right here, the part that I'm showing you, this is your lamina. Lamina on both sides come together and makes your spinous process. Pedicel. Pedicel is basically this part. It is the connection between your bumpy part and the body. Okay, so let me show you. You see all this bumpy part? See all, you see this bumpy part? This and the body. In between the two, you see this area? You see this area in between the two? Meaning this part and this part. This part and this part. In between the two. That is your pedicel. So what do we have? We have spinous process, but spinous process is made by your lamina. The two laminae come together and make the spinous process. Then you have sideways processes, which are transverse processes. Then you have the body, and the body is connected to the bumpy part with all the processes. The two are connected by the pedicel. Okay, now what is the anterior and what is the posterior? Remember, your spine is in the back. So this is your posterior because of the spine. And this is your anterior because of the smooth body. Anterior is smooth because you have lung and heart sitting in front of it. You cannot have bumpy things, otherwise these things would puncture, your heart and lung spinous processes. So these are posterior, these are not anterior, because otherwise they would be facing the lung and the heart. We don't want that. That is why the anterior is smooth, so it does not hurt the lung and the heart. Does it make sense? Okay. Now the next thing is superior and the inferior articular facet. Okay. Superior and inferior articular process and facet. So this is superior articular process. And on top of it, you see this flat surface? This is the superior articular facet. So what does that mean? That means your superior articular process is this part. And the facet is what will make the joint. So this will be your superior articular facet, and that pink is your superior articular process. Do you understand? So one is the facet, the other one is the process. Think of it like a pencil and eraser. Pencil is the process, eraser is the facet. If it is present superiorly, it is your superior articular process and superior articular facet. Now, if it is present inferiorly, then it's the same concept. So over here, this would be the inferior articular process, and the facet would be right here. And see, oh, I am on the lower one. My bad. Sorry. Oh, yeah, I was right. Shoot. So this is the facet, and this is the process. Do you understand? Now, we can look at it on our little Google as well. And we are going to type in there. Oh, vertebrae is already here. Okay, so okay, so over here you can see this is the spinous process, this is the body, this is pedicel connecting body to the bumpy part. This part right here is the lamina, which comes together this is the lamina, right? Lamina that comes together and makes the spinous process. This is the pedicel. See that? This is the pedicel. This is the vertebral body, transverse processes, spinous process, vertebral foramen. This right here is the superior articular process and the superior articular facet. And to show you sideways, oh, this is a good one. Superior articular process and superior articular facet. See that? Inferior articular process and the facet is on the back side. You cannot see it, but this is inferior articular facet. On here, superior articular process and the facet is on the other side. This right here is inferior articular process and the facet is on this side, but it's articulating. So facet is a smooth surface that makes the joint. And you can see over here how these are making joints, right? You see that? The other thing is intervertebral foramen. This right here that you are looking at, this is intervertebral foramen. These are made by two vertebrae. This is the top vertebra. This is the bottom vertebra. The two of them come together with their notches and make a complete circle, a foramen. And that is intervertebral foramen because it is in between the vertebrae. Do you understand? Now, coming back to our thing right here. So that's basically what it is. So let's see. We did centrum, pedicel, lamina, vertebral foramen. We did spinous process, transverse process, superior articular process, superior articular facet, inferior articular process, inferior articular facet, intervertebral foramen that is made by two vertebrae. So we are done with the general characteristics. Now we are going to look at the special characteristics which are special to only certain vertebrae. So let's look at Atlas. Now Atlas was also one of the Greek gods. And Atlas was holding the globe. This Atlas holds your globe, which is your head. So how do you know this is Atlas? Atlas is the only vertebra that does not have spinous process. Do you see any spinous process? No. So this is the only vertebra that does not have a spinous process. And that would be this one. And you can see that this does not have, right here, it does not have any spinous process. So, going back to our handout, let's see. All general characteristics for the cervical vertebrae. So all of the vertebrae are going to have the general characteristics, okay? What you are going to notice in these cervical vertebrae is transverse foramen that no other vertebra has. So let's see. This is transverse foramen, meaning foramen in the transverse process. Foramen in the transverse process. Foramen in the transverse process. All of them have foramen in the transverse process. And that is why they will be called cervical vertebra, number one. The other thing is atlas and axis. Atlas is called C1, which means cervical one. You cannot just write C1. If you are asked, name, identify the vertebra, then you have to write atlas or axis. You cannot say C1, C2. That would be marked wrong. You can only say, if you are asked, name the number, name the vertebra, then you write the name, cervical or axis, and then you write their number, which is C1 or C2. Now C1 is C1 because, remember, and I made the, so your spinous process is present posteriorly on all the vertebrae, but atlas does not have spinous process. It just has an arch, a big arch, and that big arch is your is what it has. Okay, it just has an arch. It does not have the spinous process. Is that clear? Okay, number one. Number two, it is going to have facet for dents. And what is facet for dents? And here is your atlas. Now look at this right here. Do you see this right here? Right here is a facet for dents. So you are looking at the smaller arch. The big arch is posteriorly present. Anteriorly, you have the shorter arch. And there you are going to see the facet for dents. So atlas has the facet for dents right here. Oh, sorry, right here, it has the facet for dents. But most important thing, it does not have body. Remember the body, this body right here, remember this? Atlas does not have the body. Atlas does not have body. So if you see a vertebra without body, don't even think twice, that is atlas. And then on the shorter side, there will be facet for dents. Now, let's see. Atlas, only vertebra without centrum, without body. And it has facet for dents, which is also called fovea dentis. So you can also call it facet for dense. Dense is D-E-N-S, not D-E-N-S-E, because that means thick. C2. That is called axis. So again, keep in mind, atlas without centrum. Axis has dens or the odontoid process. Do you understand? They all are going to have transverse foramen. General to all of the cervical vertebra is transverse foramen. However, axis is going to have odontoid process or the dens. So we are going to look for a vertebra that has dens. Dens looks like a little axis, and hence it is called axis because it has a process that makes the axis. And that process, on that your neck rotates. So it pivots and makes a joint like this, and your atlas pivots and rotates on this odontoid process or the dens. Now, how does that looks like? Here. Okay. So first of all, this is axis. Axis does not have spinous process. Oh, sorry, this is atlas. Atlas does not have a body anteriorly. It does not have a spinous process posteriorly. Anteriorly, on the inside of the arch, it has the facet for dens. This is your axis. Axis does have spinous process. You can see right here. And anteriorly, it has odontoid process right here. What you are looking at inside this red color, this is the odontoid process, top of it. And this is articulating with the facet for dens. Do you understand? So this is the odontoid process or the dens. And that is how you know it is axis. So dens makes it axis. Absence of body makes it atlas. Both of them have transverse foramen. They color coordinated it blue right here. Okay. Now, let's look at it. We did that. The next thing is thoracic vertebra. So in thoracic vertebra, what do we have? Look over here. Thoracic vertebra, it is going to have transverse costal facet. That's all. So transverse costal facet, where is that? And you can see right here as well. This is right here your dens, hence it is axis. And this is atlas because it has no spinous process. Okay. Now we are looking for thoracic vertebra, and we will go back to our Google thoracic vertebra. Okay, this is the side view of thoracic vertebra. Here. And this is a nice one. Now notice these are transverse processes, right? You see this facet right here? This is the transverse costal facet. Transverse costal facet is present on the transverse process of the thoracic vertebra. Okay? And this is another good one. This is a thoracic vertebra. You can see transverse processes, spinous process, and this right here is the transverse costal facet. Since it is costal, it's going to articulate with the rib. Okay, and that is what we said, transverse costal facet. Now, lumbar vertebra, they are going to have all the characteristics. Now, let's look at the sacrum. Sacrum bone and coccyx. Let's do both. Sacrum and coccyx. Okay. When you look at it, this is how sacrum looks like. Now, it is made up of 5 vertebrae, and they have shown it very nicely. S1, S2, S3, S4, S5. 5 sacral vertebrae fused together. That is what sacrum is made up of. So sacrum, 5 vertebrae fused together. And I am going to use this color. Okay, so this is sacral vertebrae, 5, and these are fused. We are looking for sacral foramen, medial sacral crest, and sacral hiatus. See these holes? These are sacral foramen. Do you see that? This is median sacral crest, which is also called medial sacral crest. So median or medial doesn't matter. It's the same thing. So sacrum, medial sacral crest, sacral foramen. And at the bottom, well, these are molds and not real bone, but there is a hole at here and at here through which your nerves pass through of the spinal cord. Do you understand? So here you can see right here, follow my cursor. You see this? This is sacral hiatus. Hiatus means opening. This is sacral hiatus. This is median sacral crest or medial sacral crest. These are sacral foramen, and these are 5 sacrum fused together. We covered that. Coccyx, there should be a dash between the two, not 45, it's 4 to 5. Okay, so let me put a dash in between the two. Okay, 4 to 5. Now, going back here, do you see right here? This, follow my cursor. C1, C2, C3, C4, 4 coccyx or 5 coccyx fused together and make your coccyx bone, which is also called the tailbone. Now, how do you identify one from the other? So let me show you that. When you look at the thoracic vertebra, it looks like a giraffe. And here, thoracic vertebra, when you look at it, it looks like a little giraffe. When you look at lumbar, it looks like a little moose. When you look at it, it looks like a little moose. And your cervical, when you look at that, the cervical ones, they look like little, let me show you first. Okay. Cervical vertebrae. Oh, my bad. I'm going to type it here. Cervical vertebra. Okay, so when you look at the cervical vertebrae, they are going to look like, they don't have nice photographs. Well, I'll let you know. When you look at them, they are going to look like little baby elephants, is what they look like with their trunks sticking out. Okay. And with that, let me go back and check if we covered everything. And oh yes, we did cover everything. So I am going to now stop the recording and hope you all will find this helpful.